Hello, Dr. James Bogesh, expert in health and longevity, and today we're going to talk about the potential doom of civilization as we know it. Now, that may be a little bit dramatic, but it also might not be. I've written especially, a lot about my concern with fertility treatments, if you will, or fertility experts, whatever we want to call it, where they're not really fixing the reason why a woman or couple is not able to get pregnant. They're just forcing the body to have a pregnancy using Clomid or IVF or something like that. But the reality is, the only reason an organism is here on the planet, whether you're a virus or a bacteria or a mouse or a human, is to propagate the species. That's the very most important, only reason a species is here. So if a couple is not able to get pregnant, to me that screams that there's a problem with physiology. That when it's not able to do the only thing we're supposed to be doing as a species, it's because there is something else that is so unhealthy that the body says, hey, we're not ready to raise a little one, and all that entails. That has everything to do with our diet, with our exercise, with our environmental exposures. Things like BPA and phthalates all increase the risk of things like miscarriages and infertility. Prediabetes is a massive player in PCOS and infertility. And for me, that always means that we're forcing pregnancy on a mom's body who might not be ready for it, probably isn't ready for it. There are some very small exceptions, but that's generally the case. It also means that mom has not learned how she should be living for her lifestyle, and then we're bringing another child into this scenario when she hasn't quite learned what she needs to do for her genetics, and that's going to lead to problems. And sure enough, we already know that those children are at increased risk of problems in the future, heart disease, diabetes, obesity. This study just kind of drives some of this home, and they looked at the mom's dietary inflammatory index, meaning you can imagine, we don't need to talk, fast food, higher, low quality fats, lots of refined carbohydrates. The higher that dietary inflammatory index is, the higher the risk for small for gestational age, the higher the risk of low birth weight, the higher the risk of that child having a higher body weight at 10 years of age, meaning that that child is coming out of the womb already challenged because of the environment in the womb, and then maybe because we didn't learn how we need to live as a couple from a genetic standpoint to get pregnant. Instead, we just forced pregnancy on a body that wasn't quite ready for it yet. So really starts to raise the question of that child then is going to already be behind the eight ball, is going to have to work harder to maintain a healthier body weight and avoid diabetes and cancer and heart disease and everything that goes along with that because of what happened in the womb. And we already have a scenario where obesity and diabetes is going up. Portion of that is because of our environment and the crappy the quality of the diet that we have, and the inflammatory nature of the food we have, and the environmental exposures and the lack of exercise. But some of that may be because these children were predisposed in the womb to this. And you combine that with a poor quality lifestyle, and it just is a recipe for disaster. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.